Okay, it's time then for what we are now calling as part of our series of FAQs with one of the country's leading doctors. Because remember, there are lots of frequently answered questions every week, and we think that every weekend we can get Dr. Randeep Guleria, whenever he's available to us, Director, All India Institute of Medical Sciences, to answer those questions. Appreciate your joining us, Dr. Guleria. When you did this with us, our T20 FAQs last time, it was very successful. So we are doing the sequel. And we hope to do it every weekend with you because there are lots of questions. Doctor, the first question that a lot of people are asking is linked to the mask question. What type of mask should we wear? Do-it-yourself masks for the average person, or should we only be looking at N95 masks, which are, according to the government, only for health workers?
So there are now masks which could be N95 mask and which could be a 888 surgical mask. These masks are basically for people who are the healthcare workers working in hospitals in different areas. The N95 being predominantly in people working in the COVID area, especially in the ICU, and managing suspect or sick patients who may be having COVID infection. The advisory that has come today is for what we call a face cover or a mask which is of cloth. Now, what is the advantage of this mask and what does it do? It's different from the mask because it is not something which has a very strong filter, but it helps in spreading the infection, because if I am infectious and I have a cough and I'm not aware of it, and you must understand that there are a significant number of people who have a mild COVID infection and may not even get themselves tested, but they would still transmit the infection. If everyone is wearing these cloth masks, the chance of an infected person spreading the infection to others becomes less, because to some extent these cloth masks or covers act as barriers, and therefore the droplets that can spread in the environment are stopped to some extent.
So you're recommending these cloth masks for everyone. You're saying yes. Do-it-yourself cloth masks are useful useful in this present times. Am I correct?
Yes, predominantly for people who are asymptomatic and who are not working in healthcare facilities.
Okay.
It should not be used, or we should not overuse or misuse the N95 masks. Should not be used by the lay public, because then we will deplete the masks which are actually meant for people in the front line.
Point taken. Let's turn to the second question, Dr. Guleria. At what point should one get tested? At what point, Dr. Guleria, should one get tested?
So currently the requirement of testing is basically to see what are we trying to answer, which question are we answering, because of the simple fact that the symptoms of COVID-19 are very, very non-specific. If I have a fever and I say that I have a little bit of cold, I should get my test done, that is a waste of resources and it's really not very useful. In my mind, the testing should be done in those who have severe infection, who are admitted, because we need to be sure that do we need to treat these people aggressively, those who have come in close contact, and of course our healthcare workers who are working, and we don't want that they should get infected.
For mild cough, should I get tested or not, sir?
No, not at all. You don't need to be tested.
Okay.
We may change the testing criteria, because there is another group which is basically, in my mind, a high risk group, and those are those who are elderly and those who have comorbid conditions, and they have a higher mortality. So diagnosing them early and treating them may be an issue, and therefore that is one area that we will look at, whether we need to open up testing for that high risk group.
The third question in our T20 FAQ, sir, can a person without symptoms spread virus? There's a lot of questioning over asymptomatic people. Can they spread the virus?
So initial data suggested that this was unlikely, but as more and more data has accumulated, there is some data which suggests that a small percentage of individuals may be having no symptoms and may still be spreading the disease, especially in the younger age group. And that has emerged over the last few weeks, that you can have asymptomatic people who may spread the disease. And this is a major cause of concern, because it changes the epidemiology and the transmission dynamics.
Right. Just very quickly on question 2 about testing. Are you telling me, sir, that senior citizens who get a mild cough should test? You said in general, if I have a mild cough, maybe I'll be a senior citizen soon, but I shouldn't test. But if I'm 65 plus and I have a mild cough, I go and test?
No, not as yet. Currently, senior citizens no need to be tested. They need to be more at home, not go out and
Right.
wash their hands regularly.
Okay.
The solution is not testing. The solution is preventing getting the infection.
Okay. So the next question, is fecal transmission of coronavirus possible? This has also now become a talking point, sir.
So there are studies which suggest that there can be fecal oral transmission, because in some studies, and there is limited data which said that there is virus shedding occurring in the stool samples. How much infective is this virus in terms of fecal-oral transmission as it happens in other infections is unclear. So it's unlikely to be a major cause of transmission, but this is an area of research as to can there be significant transmission besides droplets as far as the fecal-oral route is concerned.
Okay, so it's still a subject of debate. Am I correct? Of medical debate. Okay.
But fecal transmission of the virus has been shown. Fecal shedding of the virus has been shown.
Has been shown. Let's turn to question number 5, sir. How long does it take to recover from COVID? This is again a question that is being frequently asked. How long is this entire recovery process according to you, doctor?
So it depends what type of illness you have. And let's again look at the breakup that we have. 80% of individuals will have mild or asymptomatic disease, and they will recover on their own within 5 to 7 days. You will have another 15% who have a moderate disease, may need hospitalization, and they will recover within 10 to 14 days. The remaining 5% may have a severe disease, require to be in the ICU, may need a ventilatory support, and they may take almost 3 weeks to recover. So it will vary depending on the severity of illness that you have.
Right. So an interesting factoid that we are getting from India is that a number of people affected in India are in the age group of 20 to 55. While the deaths are those who are of senior citizens, Indians seem to have disproportionately, almost 70% seem to be in this age group I mentioned. Why are youngsters getting infected more in India in comparison to other countries?
So there are two things in this. One is, on an average, we are a younger population as compared to, let's say, what is being seen in Europe. They have an average, the median average age is much higher than what is there in India. So we're a younger population. Secondly, the degree of mobility is much higher in the younger population, and that's why the transmission and infection rate is higher in them. Unlike the West, a lot of our elderly stay at home and they are looked after by the family. In the West, a lot of elderly stay in old age homes where they stay together. And if one gets the infection, it transmits to all the elderly, which leads to a higher infection in that old age home and higher mortality. Okay. So since we don't have that mechanism, that we don't, all our elderly is not herded together, our mortality in the older age group is not high, and we are seeing it predominantly in the younger age group, which in my mind is a good thing, because our mortality is directly related to the age.
Let me turn to question number 7, sir, and this is being again debated aggressively even on social media. Does hydroxychloroquine work or not? Is it, I know that some people claim that it does. Is there any evidence at all that it should be used?
So we had initially one study which had come from France. More recently, over the last few days, we have got another study which has come up from China, which again suggests that giving hydroxychloroquine in moderate to severe patients who had COVID-19 even in China did show improvement in terms of decreasing the viral load and also decreasing the days of admission that was required. So there is some evidence, although it is small, because here also the number of cases was small, which suggests that it does help. But I think the most important thing to keep in mind is that we need more data. The FDA has approved this now because of this data as an emergency use authorization, because currently we have no other drug which has shown the type of benefit which hydroxychloroquine has shown. But I do agree that we need to get more data, which I'm hopeful will be there in the next few weeks.
My next question, sir, do vitamin supplements build immunity against COVID? Should we be taking vitamin supplements, particularly vitamin C?
So there is some data which suggests that vitamin C may be helpful. For the other vitamins, there is really not strong data. And therefore, there is a group which is looking at giving hydroxychloroquine in combination with vitamin C as a form of treatment. However, again, we don't have enough data to say it's useful. Generally, vitamin C is safe and can be taken. And therefore, if some people want to take it just as prophylaxis, I don't think there's much harm, but I don't think we have strong evidence to say that it's very useful also.
I can tell you, doctor, that's what I'm having every morning. So you're saying it's not a absolute treatment, but it is something that can be done. My next question, doctor, Does staying in the sun between 10 a.m. and 11 a.m. give immunity against COVID? This is being again mentioned in on social media. Is there any such evidence at all?
No, there's no such evidence that in hot weather or staying in the sun actually protects you against the virus. The virus that you get is inside your body, and the body temperature is not going to increase by going out in the sun. Also, you are having an outbreak again in Singapore, where the temperature is tropical and it's much warmer. And we are having cases also in the south, where also the temperature is much more warmer. And therefore, I don't think temperature will play much of a role.
This is an important question, and I know at All India Institute of Medical Science, I'm sure you're wrestling with it. What should patients awaiting surgeries do? I got a call yesterday from someone who said that dialysis had been held up. Others are worried about other similar surgeries. What should patients awaiting surgeries do?
So I think this is a very important question. And I think in this era of COVID-19, we should not forget the non-COVID-19 patients. And we should see how we can help them out. And although we are focusing a lot on COVID hospitals, we should also see once the lockdown comes out, is lifted, how can we help those who need surgery? Emergency surgeries for patients are being done. Dialysis, when it's required, is being done. We've also started at AIIMS a mechanism of what we call teleconsultation. We are ringing up our follow-up patients to see how we can help them. It's important for patients with diabetes or other chronic diseases like hypertension, because they need to modify their doses depending on what their blood pressure or sugar levels are.
Right.
But I think as we progress, we will have to develop strategies in this COVID-19 era to look after those patients also. It's very, very important. It will not be right if we have a higher mortality in the non-COVID patients just because we're trying to protect our COVID patients.
So therefore, very quickly, the dialysis patient who rang me up yesterday, the hospital should be giving him dialysis as per schedule?
Correct. If he is on regular hemodialysis, he should continue to be on hemodialysis. It will be more life-threatening for him if the dialysis is stopped for long.
Right. So there is this question, and I think we raised it even last time, is summer showing any effect on the virus? We are now into the first week of April. Yes, we've had more than 3,000 cases in India, but the mortality rate relatively lower. Are there some signs, sir, that summer may be having an effect on the nature of the virus in this country?
So we're all hoping that summer will have an effect, and when the temperatures touch 40, that they will have an effect. But current data is not that strong. There are some viruses which have what we call seasonality. For example, influenza and H1N1 has a seasonal variation. However, this is a novel virus, and it's still difficult to say whether it will follow a seasonality and will become less during summer months. Temperature doesn't seem to have made much of a difference because, like I said, in tropical countries like Singapore, Thailand, and south of India, where temperatures already are more than 30, we are still having a significant number of cases.
One question, and this is again a question that has been making a lot of news. Is it safe to buy newspapers? You know, the newspaper industry in particular is very worried about the campaigns being run against them. Is it safe to buy newspapers?
So I think it's safe to buy newspapers because it's not that the person who's delivering the newspaper is infected. If he was infected, he would have symptoms. And if you're very much concerned, you can see how you can try and clean your newspapers properly. The chance of transmission through newspapers is almost very, very little. So I don't think there's a problem. There are issues which come up regarding how long can the virus survive on surfaces. Newspaper, cardboard boxes, metal cans. It's been shown that the virus can survive for a few hours, and even on surfaces like plastics and steel surfaces for a longer period in time. I would suggest that even if you're using these boxes or you're getting them from the market, take a little bit of time and just clean them properly with some sort of an antiseptic solution.
Right. But the important thing you're saying, don't worry about your morning newspaper coming in. It's not COVID infected. Someone in my office asked the 13th question, doctor. This is on takeaways. Takeaway pizzas and other food items safe. A lot of people in my office want to order takeaway pizzas. Is it completely safe again?
Again, the pizza itself is cooked at a very high temperature. It will kill any bacteria or virus that is there. If you're still very much concerned, clean the outer surfaces which could have been touched by people with, again, a cloth which is dipped with an antiseptic or an alcohol-based wash, and that will provide enough safety if you're concerned about someone who's touched it and hasn't washed it hands properly.
So as long as I've washed my hands properly and the pizza has come to my house, I should be okay. Okay, good.
Correct.
That's good news for all those in the office who want pizzas. The next question, is it safe to receive a package, doctor, from an area reporting COVID cases? That, you know, we've seen this in Mumbai where there are clusters where which have been sealed. But if there was a package which was to come from an area, joining it or from that area, is there a problem?
So there's really no problem. Chances of transmission of a virus through packages is actually quite low because it travels for some time and there is it's not that the package is delivered immediately. But again, like I said, if you are really concerned about that the package may be infected and you want to be super cautious, then you just clean the package from outside using some sort of antiseptic material which will kill the virus, and that's all. But packages are safe and what's inside the package will not get infected.
My next question, question 15, is the virus, and this is linked to something we raised about summer, but in this context is about BCG immunization. Is the virus less virulent in countries with BCG immunization? And Arthur Anderson Hospital study from Houston seems to suggest so.
So there is this hypothesis which suggests that those countries who have individuals who are vaccinated by BCG, because of their immune response due to the BCG vaccine, are protected to some extent. However, it's too early to say whether BCG actually is able to mount an immune response against a virus. Remember, BCG is against a bacteria, the TB, Mycobacterium tuberculosis. So this data has to be looked at critically and has to be seen whether this is just an association that has been found, that this happens as just part of a, rather than a cause and effect relationship. So that is the issue. Is it just that it's an incidental finding, or is it that the BCG is actually protecting one against COVID-19? I don't think we have enough data one way or the other. But it's an interesting hypothesis which we need to look at more carefully, because it may be very good for us because all of us get vaccinated.
That's right. We are all BCG vaccinated. One of the doctors who's co-authored that study will join us on Monday night from Houston. But the 16th question, doctor, why do fatality rates vary in different countries? We're all looking at the curves and we are seeing that at the moment, India certainly doing much better than in Italy, and Spain were at the same stage, United States as well. Why do the fatality rates vary so sharply at the moment?
So fatality rates are dependent on 2 or 3 things. The first thing is the population age. Second is the number of cases you see per day. Because let's look at the first one. If you have a young population, your fatality rate is going to be very low. If your population is an infection is in individuals less than 50 years, your mortality rate is less than 0.5%. But as you go over the age of 60, 70 or 80, the fatality rate goes up to almost, if you're more than 80, the fatality rate is almost 13 to 16%. That means that is a very high fatality rate. Secondly, if you have a spike of cases, it starts putting a strain on your health resources. And if you have a strain on your health resources, you will have limited amount of ventilators and other things that you can give to everyone. And therefore, it compromises on the quality of healthcare that you can provide. That is why I think flattening the curve or trying to not have that spike by what we're doing during this lockdown period, and you have a limited number of cases occurring, will actually decrease your mortality rather than having thousands of cases which swamp the healthcare facility and they are then difficult to manage and your mortality goes up.
Okay, fingers crossed at the moment, doctor, as far as India is concerned on that. Question number 17. Important question, doctor, because blood tests are now allowed as part of the COVID-19 test. Are they as effective as oral swabs, is what someone is asking.
So it's important to understand what are blood tests as compared to the nasal swab. The nasal swab is a test to pick up the virus in your throat or in your nose, in the posterior part of your nose. And therefore it tells you whether the virus is there and you are infected or not. The blood test does a different thing. It does not pick up the virus, and if you have early infection, the blood test will be negative. It looks at the antibodies which your body produces once you have had the infection. And these antibodies will remain positive for months. If I have had the infection a month ago, I've been infected by COVID-19 a month ago, and now I'm all right. If I get the antibody test done, my antibody will be positive, although I have no infection.
Right.
So this tells you that your body has responded and you have the antibodies which are formed, which are there in the blood, and the drop of blood picks that up. So it's important to understand that this is not a diagnostic test. It may be used along with the clinical parameters to say whether you have had a recent infection, or if you have fever, cough, and your test is positive, that you may have had
Right.
this infection just over the last few days.
Important that it's not a diagnostic test. That links me to the 18th question. Can the rapid testing that is being done in some other countries of the world, and some are suggesting must be done in India, help in containing the outbreak? South Korea, very successful, doctor, doing that. Do you believe that that rapid test is a way of containing the outbreak?
So rapid test will give us some information as to how the let's say the pandemic is panning out in different regions of the country. And if you have an area where by rapid test you find that a lot of people are positive, then you could say that there is still ongoing infection here, and therefore there is a need to be concerned, and containment is very important. On the other hand, if you have an area where you do rapid testing with people who are symptomatic and find that all of them are negative, then you can say that their symptoms are not related to COVID and it could just be a common flu. And this area doesn't have that much of COVID infection, and therefore may consider lifting the lockdown from that area.
Okay. So you're saying that is possible over time. I'll come back to that in a moment. Have we managed to avoid community spread? You know, there are conflicting reports, particularly troubling at times from Mumbai, where there have been 2 cases from Dharavi. But in general, would you say that we are still not in stage 3?
So I would say that extensive community spread is not there, but there are definitely hotspots which have developed where there is a suspicion that there may be limited community spread, and we need to really see how we can clamp down on this, because this should not further progress to more sustained spread, and that will then lead to the next stage. So if we can aggressively prevent the localized spread which has occurred, and these are hotspots, one of them of course is Mumbai, then we will be able to prevent significant community spread.
Let me link that then to my final 20th question. Is the virus in India less virulent than the rest of the world? I asked this to you in another form, but I want to also link it to the lockdown itself. Do you believe that the lockdown to that extent is working? In your view, as we stand today, will it have to be extended beyond the 14th of April?
So the first part of the question, whether this is a virus is less virulent, is something that a lot of people have been debating upon. Not too much of data to suggest that it is behaving differently, but I do believe that we need to really look at the virus more critically. That has it mutated, and are we getting a strain which is less virulent, and therefore maybe we are lucky, and the infection, the degree of the mortality may be less. The lockdown has helped because there is definitely a suggestion that the rise in curve is not as much as we would have as is happening in Italy, Spain, or the United States. Therefore, there is definite evidence based on surveillance data that there has not been a very sharp spike in the number of cases as has been reported by US, where the lockdown was not done as quickly or as aggressively as it has been done in India. We will need to look at data, I would say, after the 10th or maybe after the 12th of April and see where we are, and in terms of a lot of factors, including what has happened regarding the migrant laborers and the Nizamuddin episode, and then be able to say whether there is a need to have a partial lifting of the lockdown or continue the lockdown.
So you're saying any decision on partial lifting of the lockdown, staggered lockdown, continuing, can only be taken around the 10th of April. Am I correct, doctor?
Correct, after the 10th of April, because then we'll have enough data to say how effective has the lockdown been, because you need to give it some time to see the effect.
Right.
The lockdown, whatever you're saying today is something which has happened almost 14 days ago.
Right. Let me therefore ask you in conclusion, bring a smile on your face. What are you doing? How are you keeping yourself? You're such an active person. AIIMS is such an active institution, such a prestige. How are you keeping yourself active in Corona times, doctor?
So I'm very active. I am busy since morning till evening. So I think my workload has increased. So it's good to be busy.
Right.
And I just keep myself busy with the work that I have.
Are you satisfied with the quality of protective equipment that doctors have at the moment? There's been a lot of debate over that health workers do not, in some parts of the country, certainly don't have the kind of equipment they want. Overall, Do you believe that we are in a good space? Do our doctors need much more protection?
So I think protecting our health workers is paramount. We have to take all steps to protect our health workers, and that means not only doctors, but nurses, but all the technicians and other staff which are working in COVID areas. Every effort should be made to protect them and keep their morale high. The equipment that we have is good. There are some local manufacturers where we assess it very carefully. So the quality varies across the board. I think the challenge is that since all of this equipment, PPE was coming from abroad, we rapidly need to ramp up our local production.
Right.
In my mind, one of the lessons that we've learned is that we have to have a lot of local production, because in an era of a pandemic, when there is a huge global demand, you have to look at what you can innovate and make locally rather than depending on it coming from the international market.
Right. Dr. Guleria, as always, a pleasure talking to you. Thank you very much. We need to make this a weekly series, really, T20 style. The IPL is not with us, but we've got you to answer 20 questions from our viewers. I appreciate your taking the time off. Thank you very much, Dr. Guleria.
Thank you. Thank you.
Randeep Guleria from the All India Institute of Medical Sciences, FAQs, T20 style.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.